Good morning. This is Angela Conover again. Thank you for joining us for the Knockout Opioid Abuse Day webinar. Really excited that we are launching our third Knockout Opioid Abuse Day. And I have with me today Rebecca Alfaro from the Governor's Council on Alcoholism and Drug Abuse.
Good morning.
And Barbara Kaufman from the Community Coalition for a Safe and Healthy Morris.
Good morning.
So as some of you who've participated in the past may know, Knockout Opioid Abuse Day is a project of the Partnership for a Drug-Free New Jersey in collaboration with the Community Coalition for a Safe and Healthy Morris, the New Jersey Department of Human Services, and the Governor's Council on Alcoholism and Drug Abuse. I also have with me today for some technical feedback and questions, Greg Startzel from my office, who many of you know, and also David Fielman from the very first Knockout Opioid Abuse Day, and he's back to help us out again. So just an overview of Knockout Opioid Abuse Day for those of you who have not participated already in the past, or just a reminder, October 6th, 2018, or October 6th has been designated Knockout Opioid Abuse Day in New Jersey. I know that this year, October 6th falls on a Saturday, which I think will provide us with some challenges, but also give us some opportunities. And I hope to discuss that as we move forward in the webinar today. And I know I have some suggestions, and Barbara and Rebecca have some suggestions on that. But looking forward to hearing some ideas that some of you may have in terms of outreach on a Saturday. It is a single day initiative to mobilize prevention, education, awareness, utilizing the prevention and treatment communities, community leaders, and volunteers. We'll go over some groups who have participated in the past. We really want to get that message out about the potential for dependency of prescribed opiate pain medicine, as well as the link between prescribed opioids and heroin abuse rates in our state. And again, our mobilization will have a dual focus. We're going to continue to try to outreach residents, parents, community leaders, as well as educating prescribers, doctors, dentists, nurse practitioners in our state. And the Partnership for a Drug-Free New Jersey will be providing all of the resources that you need for that outreach, and we'll go over that as we go through the webinar. So again, as we look at our third year of Knockout Opioid Abuse Day, we know that we need to continue to address the issue as we're seeing, unfortunately, drug overdose rates continue to rise here in our state. And we really want to get that, again, education, awareness message out. And that really is the main goal of Knockout Day. We want to build on the success of previous years. As some of you may know, we have a number of resources. I'm going to go through those again. We have door hangers that we're going to be providing. We have prescriber resource guides. We have pocket cards of information from the New Jersey Attorney General's office. We have information from the Surgeon General's Turn the Tide campaign. And all of these materials, as well as a toolkit of online materials, will be available for you to utilize to get the message out in the community.
One additional thing I want to mention about reaching out to prescribers is on Saturdays that might be a little tough with physicians' offices. However, oftentimes pediatric offices will have Saturday morning hours available. So I definitely recommend you check with your local pediatrician offices, see if they have some Saturday hours. Oftentimes they're available until about noon or afternoon time. So if you are going to hit those prescribers, make sure that you do it first thing in the morning, and then you can go on and move on to your community efforts throughout the day. One of the things that I think is a great opportunity is reaching these pediatricians, because the one thing that we know that's culturally universal is a pediatrician's office. Every child ends up in a pediatrician's office regardless of what their socioeconomic or racial makeup is in the community. So that's one thing that is consistent. So being able to get into a pediatrician's office, you're going to reach such a huge portion of your community by doing so. You're going to be reaching families. You're also going to be reaching lots of not just parents, but you could potentially be reaching grandparents and so forth through that process. So something to keep in mind, definitely check with those pediatricians, see if they have Saturday hours, get in there as early as you can, because the likelihood of them getting busier throughout that morning is going to increase. So just a little tip for your Saturday outreach.
Thank you, Rebecca.
I have to add.
Yes, Barbara.
Tremendous idea, Rebecca. Tremendous idea, Rebecca. A little technical trouble. Okay, we, besides that, a few of my coalition members had gotten excited about a Saturday because they said it would be a great time to hit ERs and to hit urgent care facilities. We know, of course, emergency rooms are prime for education about prescribing, working on that always. So that would be another benefit of a Saturday afternoon.
All great suggestions, and that's some great feedback. And last year, we had no shortage of volunteers. I know this slide said we had over more than 5,000 volunteers across New Jersey, but really had close to 10,000 volunteers at final count. I know a lot of coordination was done with large groups of volunteers. One person was able to mobilize some union workers. I know that the Governor's Council was able to coordinate with some unions who wanted to do some outreach, some businesses who wanted to do some outreach. We got a lot of feedback. I know many of you in our Knockout Opioid series that was launched as a result of the success of Knockout Day, and so many of the attendees at that town hall series indicated that they want to be involved. How do they take a next step? How do they share the information that they learned through participation in the town hall series? And one way is really to connect those volunteers with the coordinators in each of the counties, or with us here at the partnership, to really get involved in Knockout Day and to really help get that message out.
And this is a really great opportunity for capacity building for the alliances and the regional coalitions, because it's a really unique day. And oftentimes there are organizations and other entities in the community or in the county area that may not get involved or may not know how else to get involved. This is something really tangible for a lot of people, and especially that it's on a Saturday. Last year we were able to connect. One of the local unions had contacted us about how it had impacted some workers there, and they were wanting to get involved. They do offer a community service component to the work that they do. So we were able to connect them through this process. And through that, it was a great relationship that was developed in the community through that partnership. So look at this as an opportunity to connect with entities that may not normally come out for programs and things like that. This is a great community service opportunity that a lot of organizations will, I think, take advantage of, especially with those that offer that for their workers. A lot of times they do incentives and things to get them involved in the community. This is a great opportunity to connect with that.
I think too, that working with businesses, like another idea that coalition members have used this year is to work with car dealerships that are especially busy on Saturdays. I think she got that idea because we had put the door knockers on car windows often. This time we said, okay, cars, where do they have them mostly? And we're going to talk with them about putting them on the windshields of the cars in their lots and having them talk to the people as they come in. So it's another opportunity. Again, all businesses are anxious to work with this. I know in Morris County, for example, the pharmaceuticals are such an asset because they have worked with us to distribute our flyers. So that's a good one too.
Thanks, Barb. That's a really great suggestion that came out of your coalition. I know we'll see some photos, and there's some photos on the screen of putting some messages on car windshields. I know that worked out in about 90% or 95% of the communities that did that. It was a great way to get the message out. I know that Mercer County ran into a few issues at some of the train stations and public lots on that day. And if someone from that group is on the call, I encourage you at the end to just share the little experience that that you guys had. I know you were asked, some groups were asked to remove them, the signs from the cars in the commuter lot. But I only mention that because I think that what you said in working with groups that have large cars or getting permission or making sure that information is gathered prior will save a lot of energy and outreach.
And I do want to go back a couple of minutes when we talked about challenges and possible benefits of a Saturday. Another opportunity that I think we can build on this year is the playgrounds and athletic fields, because we're working a lot now, well, have always, but even more so with youth and athletes and opioid use. And so I know last year we were trying to get to a lot of the playgrounds in Morristown, but the kids were out because they were in school for most of it. So now we'll have that opportunity. I know a lot of the school athletic directors have the kids on Saturdays, so we can go to the school football fields and community fields. So I think that will be a good opportunity for us.
Yes, absolutely. And I think we're going to talk a little bit about that as we move forward. But we had some great success with Friday night football games in Bergen County, actually up in Mahwah. Spearheaded that. We're going to talk about that in a few slides. But we have done some outreach to athletic directors. And I think it's important that we look at Knockout Day as October 6th. If there's a great opportunity on October 5th or on October 12th, that we really look at how we can also take advantage of that, especially when it comes to sports. And what you were saying, Barb, about the Saturday morning, absolutely. We know even for younger children, we have, municipal leagues of soccer or other sports that may be happening on a Saturday morning. And so those opportunities at the soccer field or at the grocery store or other opportunities may arise.
So Tracy from Freedom House also brings up that on a Saturday, ShopRites are very busy, especially Saturday mornings, which is an excellent idea. And it's a great place to be. If you want to stand outside in the parking lot, if you want to maybe contact the ShopRite management maybe before the actual day or the event. But again, Tracy, thank you for the idea. Absolutely.
And again, building on the success, we have a number of you I know, or an idea for those of you who are new to get proclamations to help generate some media on the day. We're here both David, who is here with us today, and also Matt Birchenough, who many of you worked with last year, are here to help support in any of your media outreach opportunities that arise. So if you have a local reporter that you normally work with, or a television station or a radio station, you want to get a message to them, and or you want to make a suggestion or make an introduction to us with them to help promote what you're doing, as well as Knockout Day locally in the community, please reach out. We will assist in any way that we can. And again, here is a copy of the resolution regarding Knockout Day. I just mentioned this again and included this. So if anyone needs a copy of this, or we'll make sure we have it in the toolkit. I know last year there was some questions or people who were looking to show this to some of the stakeholders in their community to show how it is a designated day. So that information is in there. So I know we've discussed a little bit on how we could collaborate for success. I know we've had some success stories in the past. I think the photo that you're looking at is from Somerset County, and it's Congressman Lance, who was able to walk around with groups of volunteers to spread information. So any local, we'll call them local celebrities, but anyone, any stakeholders who you think may be available or may be interested in participating, happy to help you coordinate that, or if you coordinate that, happy to help get some media outreach, media coverage for those events. Rebecca, did you want to share something?
Sure. Once again, we are proud to partner with this initiative for the third year in a row. I remember, having conversations when we were trying to bring this idea to fruition, and to see it in its third year and as successful as it has been for the previous two. We do, again, have great hopes for this third year being an even greater success. So again, really glad to participate. We've had great participation from in the past from the Alliance Network. This is really another great opportunity to join in really creating that collective impact. And we talk about how, oftentimes unifying our efforts and working collaboratively, it's easy to see how that looks on paper, but this is an opportunity to really get out into the community, work together. It's a unifying day that we're all doing the same thing and uniting our efforts collectively and creating that echo throughout the community, the county, and the state offers a really great opportunity for creating awareness, for providing some education. And again, those are really the key tenets of the Alliance program. So this is really very much in line with creating that community level change, really participating as an entity in the community, making sure that people know who you are, why you're there, the work that you're doing. It's a really wonderful day to come together to do that. So excited that this is the third year that we get to participate. And again, thank you to all of the alliances, the members, and everybody in your communities that have been doing this work. I think the fact that we're going on our third year shows the success that we've had so far. So the fact that we're continuing on with this effort in our collaborative approach is really wonderful.
So speaking about collaboration, we have a lot of collaboration right now in our comments. And I would encourage everybody, if you haven't taken a look at our comments, to read through them. Tony and Mike, I assume, Tony, you are also an athletic director, but Mike is an athletic director in a high school in South Jersey, and he wants to be able to use our materials and promote the day the Friday night before the day at the games. And then Tony also pointed out that they'd like to get statewide approval for armbands or helmet stickers. Excellent ideas. And thank you for that. We will follow up with the NJSIAA, and we'll follow up with both of you to see how we can make some progress on that front. Thank you again.
Absolutely. And I know that we have some participation right now on the webinar from some of the leaders in working with athletic directors last year. Really took that pilot and ran with it in Bergen County. And so I hope that when we open it up for questions and comments, if anyone can share some success with Tony and Mike, that would be appreciated. I think, Barbara, you're going to add.
Thanks, Angela. I want to comment about the alliances. Rebecca had said the tremendous work that they're doing, and I can certainly vouch for that in Morris County. The alliances have been the feet of prevention work that my agency has done. We work with them often. They will be with us, I know, on Knockout Opiate Abuse Day in each of their towns. We have also been lucky enough to collaborate with our law enforcement in Morris County. Our sheriff had gone with us and knocked on doors. Our prosecutor had also worked with us and had even, I remember he put some of our banners and door knockers around his offices in the courthouse. We had also collaborated tremendously and will again with the hospitals this year, especially. And we are offering Friday night a concert. We call it the Knockout Opiate Abuse Concert. We will feature performances by those people who have written songs about how they have been impacted by opioid use. We will there have Angela will speak with everyone there, and I will, of course. But the big thing that I think will make this year's a better success is that we're doing it in Morristown Medical Center, the Malcolm Forbes Amphitheater. So we're working with the hospital. We will invite physicians and nurses, pharmacists, of course. Anyone who wants to come is certainly welcome, but I like this collaboration with the medical community. So I'm excited about that too.
Absolutely, and I know we're going to talk a little bit more about the Knockout Day song, and last year it was such an innovative way of engaging your residents in Knockout Day. And also, you touched on Atlantic Health and their support. And I have to say, from the first year, and this is maybe perhaps a model that others could follow who have great relationships with their hospitals or medical centers. Atlantic Health had reached out in the very beginning and said, can we have some messages to give to our patients who are leaving that day? Can you give us some prescriber guides, and we will take on distributing them to all of the prescribers in our network. And so Lorianne, who's over at Atlantic Health, I'm not sure if you're on, but really such great partners in their commitment to get the messages out on Opiate Abuse Day. And so just another idea, if you have a great relationship with a hospital or medical center, that you can perhaps replicate.
Two other populations that I also want to mention in outreach, particularly for collaboration, are your youth. This is a great opportunity to connect with youth, to get them to participate in the effort. Oftentimes, as many of you have probably heard me talk about before, we are always planning for our youth, but we often leave them out of the process. So this is a great opportunity to engage our youth groups and our youth leaders in this process. Additionally, we have the opportunity to engage faith-based leaders. And that's another area, again, that I think we're always looking to try to build partnerships with, build relationships with. And from what we often hear about within the faith-based community is that they are often looking for resources and looking to connect with other community members that are working on this initiative, because they do have families that are struggling with addiction. They have, they're always looking for prevention opportunities and programs. So reaching out to your faith-based leaders is another great opportunity for spreading the message. And oftentimes many of them have youth group or youth organizations that exist. Also, a lot of the cultural organizations have youth participation. So going to your cultural institutions as well is going to be important to try to engage your youth. So again, looking at those and not wanting to miss out on that opportunity, especially on a Saturday before, while school is in session, for kids to participate on a Saturday would be wonderful.
And I know Barbara wants to add something, but just to add on to Rebecca's comment about faith organizations, that's another possible advantage of a weekend knockout opioid abuse day. So there's a lot of opportunities that come from that. And again, if it's the Friday before, it's the Sunday after, looking at that as a possible way to get the message out.
And just the faith-based community, I just thought of something too. One of the things that we talk about in our outreach with our strategies and trying to reach the community is looking at the church bulletin. And Angela's going to be reviewing some messages, which if you have a faith leader that is taking an interest in this, this is a great opportunity to have the messaging placed in the church bulletin for that weekend of that.
Absolutely.
So
we're even encouraging some faith leaders that you may have a close relationship with to include it in their sermon and their comments that day.
Yeah, Angela reminded me of something that I had forgotten when we talked about the hospital. Atlantic Health handing out the brochure as the patients were leaving. But what they also did was provide the message on the TVs in each of the rooms. And so as the people were watching TV or whatever, not a techie, but however they did it, they got some of the messages that Angela will talk about in a bit onto the TVs. And I thought that was a tremendous idea.
Again, just ideas that you can either replicate or you can adapt to best fit your community. So again, some of the messages that we have are from some campaigns that the partnership has utilized over the past few years. So these are the images that you'll find in the toolkit, as well as on the door hangers and in the materials that you're provided. Anything can be adapted or updated if you need to or want to personalize it for your community. I know in Morris County last year, Randolph Township or Randolph Borough wanted to get messages out, but they couldn't go door to door with the door hangers. And so what they did was reached out to us, and we were able to help create a postcard that then they sent out to everyone in their zip code. So if that's something that you think might work better, absolutely happy to work with you on that. In that situation, we would do the design work, but you would take on the printing and the postage costs. Here's some new, on the screen now, some new door hangers that are going to be made available. The Partnership's 2018 campaign is addiction, it also breaks hearts. And so we're going to have a variety of different door hangers this year. Included in that will be some of the images that you see here on the screen representing the new partnership messaging. And the reason for that is these messages are out on New Jersey Transit, trains and buses. I'm sure many of you have seen the billboards. They're up and down the turnpike. They're in Times Square, on PATH trains, bus shelters. And so really just trying to reinforce the messages connecting people who may now receive something at their doorstep they've seen on their commute to work, and maybe that reinforces the message and helps them get the information. The flip side of these will also have the information on the connection between opioids, prescribed opioids and heroin abuse rates, as well as some New Jersey statistics on the crisis epidemic, and also resources that are available, including links to the Governor's Council No Addiction website.
The nice thing about the new door hangers is that it also allows for us to remain culturally fluent within our communities, ensuring that we are choosing images that reflect the cultural makeup of our communities, the ethnic makeup of our communities. And so by having more options to choose from, you can do that and making sure that you're really reaching every portion of the population, which again, is vital to our work. We can't just fragment our efforts. We really have to ensure that we are including everybody. And these new door hangers with the images, I think, give us some nice opportunities to continue to strive towards cultural fluency.
What I've noticed too with the new door hangers is that it talks about protecting family and friends also, which has become really important to understand, as we always have known that addiction is a family disease, but we sometimes ignore the family and friends. And this new campaign does include, which is great.
Absolutely. Excellent point, Barbara. So again, just here's some success stories, some volunteers from last year, some different ways that people were able to get messages out. And again, you see youth represented, you see some seniors, some volunteers who really just took to the streets to get the message out. And also, I think it's important that to note that one of the great successes that we've had in previous years is the outreach at municipal and county buildings and ways to get messages out to people as they are in their workplace. And so I know on a Saturday that may appear to be a challenge, right? Because in previous years, a door hanger was left on every office door in the municipal complex or in the county building. Well, what a great Monday morning surprise, right? To find that, or what a great way to kick off the weekend of Knockout Opioid Abuse Day by having those up on Friday. So don't feel limited by that October 6th landing on a Saturday. If you feel that it causes a challenge, look at ways you can adapt it, because really the goal is to acknowledging that Knockout Opioid Abuse Day is on the 6th, but also acknowledging the need to get that message out. And again, we have the prescriber guides that will be available. The Governor's Council is once again printing those. We have new information that we've included in there. There's going to be an online CME that the partnership is going to be making available to all prescribers in order to fit the regulations that are in the new legislation that was passed in February 2017, which requires 1 hour of education on addiction, and there'll be a CME, that 1 hour online CME that's available. So we've included some information on that because last year so many of these went out and we received so many phone calls asking us, I know I'm a prescriber, I want to get more information, how can I do that? And while we do offer, and I know many of you are aware of the Do No Harm Symposium series, really only offer 4 to 8 of those a year in different parts of the state. And so this will give an opportunity for any prescriber who's interested in the topic to become educated on it in an easy 1 hour format. So we've included some information in the prescriber guide for that. I should also mention that we have throughout the course of, since last Knockout Day, received requests for thousands of prescriber guides from prescribers across New Jersey. So the work that you're doing is really making an impact because one person is receiving it and giving it to a decision maker. They've been reaching out to us asking for 200, 400. They really, people are really looking for this information and really engaging in developing strategies for safer prescribing. And this is oftentimes the first step for that. So thank you. Just note that what you're doing is really, really making an impact. We're definitely seeing it here in our office as people say that I received this. It was left on October 6th for us. And, you know, how can we get additional information? And this is just, again, an image of the prescribing law that I mentioned earlier. There'll be additional resources that are also available. I know last year these were really popular. These are the Before Taking Opioids, Ask Questions resource guides created by the New Jersey Division of Consumer Affairs. So we'll have a number of those available. They also are available in Spanish and English. We'll be providing those and the in-person trainings Again, we're looking if someone wants to take a leadership role to contact us so we can get some county teams going. I know we have a lot of county leaders or community leaders who are on today. We'll have media lists and prescriber lists to share with you. We'll also have the toolkit that we're continuing to update. We're going to do the in-person trainings to share the information. Once again, we have the Northern training scheduled for September 12th in the evening in Morris County. Share some information after this call. The South Jersey training is to be determined. Haven't chosen or been able to secure a location for that yet, but hoping to do so by the end of this week. Just a note for previous participants, the first year we had the trainings very close to October. It was the last week in September. And we got some feedback from you guys that there wasn't enough time to coordinate. Last year, we moved the trainings to early August in order to try to accommodate that. Got some feedback that was maybe a little bit too much time. So we're hoping that this early September, post Labor Day, everyone's kind of getting back to school and back to the office. We'll have some great success, and it will be convenient for all of you as well. But if you need some materials before that, we'll have some stuff here in Milburn. We can make sure that we get that to you. And of course, leading up to the day of, if you need anything, please, reach out. Some great ways that we had some interaction. Again, pizza boxes were a really great outreach opportunity. I know local businesses were great partners. Again, getting youth involved, getting faith-based organizations involved, really looking at, I know Freedom House went out to the grocery stores and put messages in bags. We're trying to coordinate with the New Jersey Food Council to really get more of an organized approach on that. But absolutely, if you have local connections to any business, drive-through restaurants, your local libraries, your local movie theater, any small business, or any business in your community, just ask them if they can just be involved on that day. We also had our current Attorney General, former prosecutor from Bergen County, who participated last year. He walked around and spoke with some kids from Garfield and spoke to them before, and we've been in contact with his office. He's such a great supporter of this issue, as well as the efforts of awareness and education that are associated with Knockout Day. And so it's great to be able to get that support and that level of participation. And I know we touched on it a little bit earlier about high school sports, but really just want to make the connection. There's a great article in the Bergen Record. We'll make sure we have that in the toolkit for you guys to read. I know it's a little bit small on here. We can also send out a link, but up in Mawa, there was some great coordination that was done with some local teams, high school teams, to really get messages out, announcements made during games. We were able to provide some wristbands for attendees. Information was shared at some of the largest games that were happening in the region. And so it was really great to be able to work on that level and really get messages out to parents, to athletes, to all of those community members in attendance. And Barb spoke a little bit earlier about the Songwriters Contest in concert. Again, last year, that was so great. It was such a great opportunity. CARES room was overflowing with people who were out to support Anna and Anna, who wrote the song Invisible, as well as all the other contestants. And we actually received some recognition, New Jersey Ad Club Award for Anna and Anna's song, which was really great and a really great way to get that message out. Again, we have the media toolkit. If you go to drugfreenj.org/knockout volunteers, you'll find information including this presentation. We'll also have sample letter to the editors, sample introduction letters, some county lists of coordinators or people who are interested in participating, digital messages that can be used. We'll call them digital door knockers that can be used to really get messages out if you have email lists. or any other type of outreach opportunities, whether it be on social media or traditional media, anything that that we have. We'll also have sample advisories, sample press releases, and David and Matt in my office will be utilizing social media here. We'll really be working on getting messages out that whole weekend, but specifically on that day for you to share, localize, and personalize. So I think we're at the end of the presentation. I just want to mention that before we go into questions and answers and anything that we can answer and help answer, but also I would love for anyone who's on the call who's participated in the past who has a great strategy that they would like to share, I welcome you to please do so. And I also want to mention that I just received word that Knockout Opioid Abuse Day is going to be recognized as a health, marketing, and communications strategy by the CDC. And so last year we spoke at the Health Marketing Conference. This year we're actually receiving recognition. I think we won Silver Award for that. We've won and been recognized by the Blue Pencil government communicators for really being able to get a message out across the state for all of our collective efforts in Knockout Opioid Abuse Day, as well as by the New Jersey Ad Club. And so thank you for your support and help, because really we wouldn't be able to make the impact that we are making without you. Also just wanted to make a note that we are working with Rutgers University to evaluate the success of the strategies that we're using on Knockout Day and how we are really making an impact. So I just wanted to share that. Greg, I think, is going to do a roll call for us to get some questions, if anyone has any.
Thanks, Angela. I don't see that anybody has requested to speak at the moment. We have been engaging on chat with a bunch of questions. A lot of it has centered around high school sports, which is actually great. That's where we're probably going to see the most interaction with families and kids at the same time, specifically at the football games on Friday night, October 5th.
Absolutely, absolutely. I mean, high school sports as well as youth sports. So I want to make sure that we know that there's also Saturday morning sporting events that will be taking place.
Correct. And we do have some questions about how early people can pick up materials. If they want to get started on distributing this to their volunteers in their local area and or county. Also, people want to make sure that what we go over today is going to be sent out through email and made available on the web, which of course we will give you links through email to access the online toolkit.
Exactly. And this presentation will be in the online toolkit.
There's questions also about where we pick up materials. How do we basically get a hold of them? So Angela, I guess you'll go over them.
Absolutely. So what we've done in the past and what's worked out really well is we hold 2 regional trainings, one in the South and one in the North, where we'll bring all of the materials, thousands of pieces of material with us. We'll do a little training. Barbara's going to actually host the September 12th training. It's going to be held in Rockaway at CARES. The event is going to kick off at 6 p.m. with some light refreshments and dinner. And then we'll do a very short training. We'll be on hand to answer any questions. And we'll have boxes of materials for you to pick up at that location. We're going to replicate that exact same model in the southern part of the state later that week or the following week. We're just still determining the specifics of where we're going to hold that. But we'll definitely share that information. If you need materials before September 12th, we will not have the prescriber guides until the first week in September. However, we do have some door hangers from last year still available. So if you feel that you need them and you can use them prior to that date, please feel free to send me an email and reach out.
So yes, there was a question about reusing old material from last year. And in the chat room, we had discussed that perhaps some of the material that people have from last year may have some outdated language or may have some outdated phrasing. So they need to be careful. Folks, if you're listening, you need to be careful about the material you're handing out. just make sure it's not date sensitive. It doesn't have 2017 on it. Also, we have switched, if you haven't noticed, we've switched from opiate to opioid because it basically covers a wider variety, a wider and broader segment of prescribed drugs. So just keep that in mind when you're looking at old materials you may have lying around from last year.
Absolutely, that's a really great point. And I know that there are some additional resources and websites that we've made available on newer materials. But again, if you have need for materials before the week of September 12th, please feel free to send me an email, reach out, and we'll figure something out to get something to you.
And I know that last year, and if people could not come to the training, which I hope they do, but if some were not able to, we left some materials at my office so they could pick them up later too.
Absolutely, and we also last year the Southwest Council. I think Donald was on the call. I'm not sure if you're still on, Donald, but Southwest Council hosted us last year, and were really great in doing the same thing. They kept a number of materials at their site, so if local people needed to stop by and pick up materials, they didn't have to. We didn't have to arrange it for Millburn. They could actually just pick them up down there.
And Angela, if you could just maybe elaborate in finer detail about what the materials are. We've talked about door hangers, and people are questioning or asking questions about, okay, there's door hangers, but what else is there? Are there pre-recorded PSAs that we have available? Are there, as you said, postcards that are going to be made available, and so on?
Sure, absolutely. So the materials that we'll be handing out at the training physically that the partnership and the Governor's Council are printing include the prescriber guides that are being printed by the Governor's Council, as well as the door hangers that the partnership is printing. So we'll have those for you to physically take. We'll also have the cards that I went over and discussed, the additional resource cards before taking opioids, ask questions that are provided by the New Jersey Division of Consumer Affairs. So there'll be those available in Spanish and in English. We'll also have some flyers that are available on hand for you to take, some posters and some other resources in smaller numbers. In the toolkit, in the online toolkit, there'll be a number of materials available in all different formats for you to use. Here's an image of the toolkit. You'll just go in the toolkit. You'll be able to download sample press releases, flyers in different languages, this presentation itself, some multimedia clips that David is making to, incorporate some of the photos from last year, as well as some of the music and some of the video clips that we have. So I hope that answers the question that came on.
Additionally, we will also make sure that our county coordinators that oversee the Municipal Alliance program will have access to materials. We will be distributing those as well at their September meeting, so they will have them in late September, and we'll be able to distribute those as well to many of the alliances.
All right, great. And I know that your office in Hamilton also had some extra materials. Mm-hmm. So for people in that kind of central area of the state who needed additional supplies and resources, again, they wouldn't have to come to Millburn or to the South Jersey location or up to Rockaway. They could go to Hamilton to pick them up. All right. Do we have any other questions? All right. I encourage anyone to please reach out if there's anything that comes up after. If there's something that you feel that you need, happy to work with getting that for you. I know last year with the Friday Night Lights project, we were able to get a specific flyer done, and we were also able to get some bracelets, some wristbands out. We're going to look into the helmet stickers. We're going to look into some of the other requests that and comments that you guys have submitted. But again, anything else, any other great ideas, please feel free to reach out. Thank you again for your participation, not only today, but in Knockout Opioid Abuse Day. Look forward to working with you over the next few months to get this underway again. So thanks so much, everyone. Have a great day.
Thank you.